But as the world tries to get a handle on this, what do we know about it? Will the vaccines remain effective? Will travel bans do anything? Let's find out. Joining me now is Dr. Peter Singer, a Canadian physician who is the special advisor to the Director General of the WHO. And he joins us now. Dr. Singer, always a pleasure to have you on the program. Hope you and your family are well. There's lots of questions about the new variant, the Omicron. What do we know about it, and what should we know about it?
Thank you for having me, Evan. What we know is that it has a lot of mutations and that it can change the epidemiology in terms of the percentage of a particular type of variant. What we don't know is whether it's more transmissible, whether it changes the clinical severity of the disease, or whether it has an effect on the effectiveness of vaccination. But we're working very hard with researchers around the world to figure out those questions, which are obviously the key questions, Evan.
Okay, how transmissible? Not sure yet, but it seems more transmissible if some of these countries are any indication. Do the vaccines work? What is the fatality rate? We don't know all of this issue. When will we get solid answers on do vaccines work? Is this more deadly?
This will take weeks to sort out, days to weeks. But in the meantime, Evan, there are things that individual Canadians can do. This is a time to follow the advice of public health authorities. We have excellent public health leaders in Canada. And also to raise your guard. You know, if you're not vaccinated, please get vaccinated, because that works against a wide range of this virus, and use the public health measures. You know, outside is safer than inside. Be in a well-ventilated space. Wear a mask, and use physical distancing. It's time for people to raise their guard, and that's what we can do while these answers are being sorted, Evan.
But you know, our guards are being dropped. It's the holiday season. People are traveling. People have said, well, we're through this. The COVID rates are low. The vaccination rates are high, especially in Canada. Yet we've got them here. So, like, are we going backwards with this new variant? Just give me a sense of how is this the beginning of a fifth wave that we've just got to, however reluctantly, wake up to?
Too early to tell, too early to know. You're right. It's been a very strong vaccine rollout in Canada. But now's not the time to let down our guard. You know, we may be done with COVID, but COVID ain't done with us, and it definitely ain't over. And, you know, speaking of vaccination, one of the main ways to keep Canadians safe, Evan, is to vaccinate the world. We've got 70, 80% vaccination rates in Canada. That level of fully vaccinated is 7% across the African continent. Only 1 in 4 health workers across the African continent is vaccinated. And what that means is that the virus has free rein in unvaccinated populations. Viruses love to mutate, and the more it rages, the more it mutates, and the greater the risk of variants. So if we want to avoid the next variant, then we have to vaccinate the world. That's the best way, or one of the best ways, to keep Canadians safe. We want to slam the barn door shut before the horse bolts.
Well, in other words, this may not be the last variant. We don't even know what this is. Just really quick, what's the WHO's position on travel bans? Canada has banned travel from about 7 Southern African countries. Other countries have done the same. Are these effective at this point?
So the rules of the road on travel restrictions have been set by countries themselves. And so it's the call of governments. But what WHO says and what those rules say is that the restrictions should be risk-based and time-limited. And we also need to keep in mind 2 really important things. Firstly, they're definitely not a silver bullet. You know, they have real limits on their effectiveness and have to be part of a comprehensive package of measures. And secondly, they sometimes create perverse incentives. So here, you know, a huge shout out to the governments of South Africa and Botswana, and to the incredible scientists in South Africa who used cutting edge science to find this variant. We want to incentivize that kind of transparency. And travel bans may do the opposite. You know, that scientist
like
who discovered
disincentivize a country from admitting they've got a new variant?
Yeah. I mean, for example, to be very concrete, the brilliant scientist in South Africa, who was the person who ran the lab that found this variant, was tweeting today that as a result of the travel bans, he can't get the reagents he needs to keep being essentially the eyes and ears of the world. Whether that's in South Africa, whether that's in any country in the world, we want to incentivize transparency, and that's a negative effect of travel bans as well. And again, you know, big shout out to the government of South Africa and to the cutting edge scientists, and also the government of Botswana that reported this, because these are our eyes and ears. That's the way to keep the world safe, and we definitely want to reward that kind of behavior, not punish it.
Okay, well, we will speak to the High Commissioner from South Africa about this very issue coming up later in the program. But Dr. Peter Singer, Special Advisor to the WHO's Director General, great to have you here and your critical view on this issue. Thank you, sir.
Thank you so much, Evan.